More often than not, I have been into these situations where I'm actively engaging in a conversation with somebody and I'm telling them about my profession, what I do, and how I help people with their mental health issues. And the first statement that they say to me is that, so you're basically a psychiatrist who gives medications, right? And that's the one of the biggest misconceptions that I want to address in this video. Think of it in this way. There are two twins who are born and brought up in one family, but they have different personalities and approaches to life. And that's exactly the case between psychiatry and psychology. Let's take an example of an OCD client. He comes in, he talks about his condition, he shares that he's unable to focus on his job, he's unable to concentrate on his family, he's unable to socialize, he spends much time thinking about his condition, thinking about his symptoms, and they have gotten worse. In that case, what does a psychiatrist do? A psychiatrist would prescribe the OCD client with medication. That medication would help the client in reducing the severity or the intensity of those OCD symptoms. Now, why stability is important? Because once the intensity of those symptoms is reduced, only then the client will be able to understand the reasons behind those symptoms. And that's where we psychologists come in, because the goal is not only to reduce the symptoms but to understand the reasons beneath those symptoms. What we do is we explore their family dynamics, the relationship with their parents, their siblings, their spouses, their children. If at all they have gone through any kind of abuse in their childhood, or they have gone through any kind of trauma, loss of a loved one, physical abuse, domestic abuse, anything of that sort that might have contributed in triggering those symptoms they are going through. And before we jump onto the conclusions that, okay, psychiatrists only do medications and psychologists are talking cure, no. We do informal assessments, we do formal assessments, we do clinical interviews, and based on the contributing factors and their family dynamics, as I discussed, based on all these factors, we develop a treatment plan for them. And the treatment plan varies from person to person. It includes different behavioral techniques, relaxation techniques, cognitive techniques, coping strategies, lifestyle changes, changes in eating or sleeping habits if necessary. Perhaps the question isn't psychiatry versus psychology. It's more like what the person actually needs right now. Because it's not about the diagnosis, it's about the person behind those diagnoses. And as psychologists, we are collaboratively working with psychiatrists in order to help that person.